All right. Well, good morning, everybody. Thank you so much for being here with us in our mental health symposium. Truly appreciate you taking the time of your day to be here with us. My name is Iris Contreras. I am the mental health and community outreach coordinator for AVANCE-North, Texas. Our mission is to help families in the North Texas community through dual generational educational classes and programs. Our role in this mental health symposium is to educate our community in services and resources that are available to them so that they can do well and thrive in their environment. Today, we have our friends from the Garland Police Department, Mr. Todd, and our friends from Parkland, Mr. Patrick and Mr. Andrew. And we have Miss Claudia Smith from NAMI, and they are going to be in this symposium, our English symposium, and they will be in our Spanish symposium as well, giving some information to our other participants in the Spanish language. So again, thank you everybody for showing up. I truly appreciate it. We will be recording this presentation so that whomever was not able to join us today can see it at a later time in our Facebook page and our YouTube page. So I will cede the floor to Mr. Patrick and Mr. Andrew to introduce themselves, and then we will move forward to Mr. Todd and Miss Claudia so that they can give you guys a little introduction of who they are and their roles in their respective organization. Mr. Patrick.
Sorry, I was on mute. Good morning, Iris, and thank you guys for having me. My name is Patrick LeBlanc, and I am a community educator in behavioral health with Parkland Hospital and Health Systems. My primary role at Parkland is to provide community education specifically on mental health and behavioral health issues. That is both to the community, but also internally to certain Parkland staff. We want everyone at the hospital to have an idea that even though they may be dealing with someone that's, come in with pregnancy, or they come in podiatry or any other kind of specialty, that there are things that may influence their mental health that may affect them as a patient. And so we want to make sure that we're trying to move to a trauma-informed environment. And so again, my role is to really educate, just keep people informed, to make sure that we don't block out that mental health factor that a lot of people may carry when they come into the hospital. So that's my role.
Absolutely. Thank you so much. Mr. Andrew?
My name is Andres Moran, and I'm a mental health counselor here at Parkland Health, and I work at Parkland Hospital, and I work primarily with the HOMES program, and we provide medical services, behavioral health services to the shelters in the community in Dallas County.
Perfect. Thank you.
Units that go out to the shelters, and we have a medical provider there, a nurse, and we see folks in the different treatment centers, and also in some of the major shelters here in town.
That's wonderful. Thank you so much. Mr. Todd?
Hey, it's great to be with you guys here today. I'm Todd. I'm the mental health liaison at the Garland Police Department. I've been with the Garland Police Department for just over 19 years. I spent 16 and a half years on the street in patrol. So I have a lot of, firsthand lived experience with families and people that are in a brain health crisis. And what we can do to try and help those families and help those people, those patients that are in a brain health crisis. As the mental health liaison at the Garland Police Department, that's one of my primary functions, is to do follow-ups with these families, with these patients, and try and see what we can do to work with them and get them to some of the most appropriate, geographically appropriate and appropriate for their condition resources that are in this community. So kind of like Parkland, they would be someone that I'd be working with the family to direct them to. And there's a myriad of other high quality resources in the community, but that's what my passion is to connect these families with those locations and those resources. A little bit about myself. Been on the SWAT team here as a hostage negotiator for 10 years now. I'm a TCOL certified mental health officer. I'm a suicide and crisis center North Texas certified telephone crisis counselor. I'm a GPD or TCOL certified TCOL 1850 crisis intervention training instructor. So I instruct officers all across the Metroplex, have for over 10 years, really closer to 12 years in CIT and in making these meaningful connections with someone that's in a crisis. I've been certified by DPS as a officer resilience training leader and instructor. I'm certified in the prevention of law enforcement suicide, the reduction of our own personnel dying by suicide. I'm a member of Garland Police Department's Critical Incident Stress Management Team. I'm a certified field training officer. I'm a mental health first aid certified instructor. I'm the current president of NAMI North Texas. And the last thing, and I'm not like trying to at all pat myself on the back. I just think it's really, really important that when I go to training, when I hear a speaker, like I really want to know that they're a content expert. I don't want to just like take their word for it. I want to hear all this stuff that makes them a content expert. I think it's really important. And I'm basing that on in law enforcement. A lot of times you'll see training out there and there won't even be one blurb of the person's resume. I'm just supposed to assume that they're knowledgeable. And it seems to be systemic in my field that we don't even have anything of the person's credentials. Just, yeah, you should sign up for this training. And the last thing that's really, really helpful in this community, and NAMI North Texas is a big partner of ours, is in 2019, I founded the Law Enforcement Mental Health Alliance of North Texas. And just real quickly, that alliance has helped us in North Texas from Mansfield to Kaufman County Sheriff's Office, everywhere in between, over 30 some agencies that we can come together and meet and talk about, you know, what are some of the best practices in CIT? What are some of these best practices in working with these residents and these families that we serve? So it got us out of our silos. I wasn't just working on, oh, what do I know at Garland PD? And I'm the smartest person in the room. Well, you know, that's not the case. I know there's some really good things going on in Plano and some really good things going on in Grand Prairie and Dallas and Mansfield and Kaufman County, and I need to know about that. So we formed this alliance. We're approaching 250 individual members. It's been just a really, really great working together as a community. And people from Parkland are part of our alliance, and a lot of other people, Grand Halliburton Foundation, NAMI, the list goes on. A lot of culturally competent people that are assisting us in law enforcement. So I know that was kind of long-winded, but I'm just really, really happy to be here. This is how we get better. This is how we make these important improvements, by working together and really, you know, because we're all passionate about the same thing. We want the best for these families that we serve.
Absolutely. Absolutely. Thank you so much for being here with us and bringing that experience, because as you mentioned, sometimes we are just supposed to assume that a person walking into a room saying, I am competent to share this information, is going to share the information from a place of harmony and a place of peace. And that's something that we need in our communities. And sometimes people don't. They have the knowledge, but they don't have the tact to talk to people. So thank you so much for sharing that. Miss Claudia?
Good morning. My name is Claudia Smith, and I certainly do not have all the titles that I have, but I'm a family member. I've been for almost 36 years. And whenever my daughter got diagnosed and put in a hospital, it was a crisis. And we didn't know what to do. And for years, we didn't know what to do. The doctors didn't tell us what was going on, how to come up with a solution for her to have a stable life. And for years and years, we've gone from hospital to hospital, from doctor to doctor, from medicine to medicine. And I moved to Dallas. And by pure accident, I find NAMI. And that opened my eyes. And I say, I want to know, I want to talk about this. I want a big things come out of my shoulders because I knew that somebody was listening to me. And I said, I want to do this. I want to teach. I want to hold people's hands and tell them the ropes, show them what to do, when to ask for a psychologist, when to go to a psychiatrist, which hospital. You have insurance, you don't have insurance, medical insurance. I said, I want to give the power to the families because they are like a blind follow another blind like I was. And I said, once then I retire, I'm gonna do this for the rest of my life. And that's what I plan to do. I'm part of the board member of NAMI in North Texas. And I also in charge of the advocacy committee. I do the best I can. I'm teaching classes in English and in Spanish for families. So that's basically my story.
Thank you so much. Thank you everybody for being here. And today's symposium, we wanted to talk about how families can go about in interacting with the police department or with hospitals when there is a mental health crisis. In 2014, my uncle was lost for 3 months in California. We are a family that is undocumented, and my parents and my sister and I are here in Texas, and we didn't know how to help him all the way to California. His daughter was there, but she didn't know how to help him either. We didn't know how to navigate the system or whom to ask for help. They found him and he was diagnosed with schizophrenia. And as we know, sometimes when there is a mental health diagnosis and you're not prepared for it, you struggle a little bit and your family dynamic changes. So then my uncle came to Texas because his daughter had other, she had family members, she had other illnesses that were in the home that she had to give priority to. My uncle came here and it completely changed our family dynamic. And we have to move around and ask what services were available. I was lucky enough that I was in school and that my major was in mental health and substance use disorders. So I had guidance from very equipped people. And then I tried to give help to my family so that they could understand the things that I was learning at school. And that's how we found Miss Claudia. And Miss Claudia was a really big part of helping my family understand what was going on with my uncle and his diagnoses and connecting us to services as well. So all of these programs are meant to do that, to educate and equip people to have resources available for when there is a crisis. And with that in mind, I will mention to the people that are on right now and the people at home that will see this recording later on in the day to please take note of the things that are being mentioned that will maybe be what truly helps you or your neighbor or another loved one in the future in case there is an emergency. There are going to be numbers that are going to be given out, and I will do my best to get all of this information and send it to everybody afterwards in an email, as I will be adding a link at the end of the symposium that will be a survey, and you can add your email there, and I will be sending out all of this wonderful information that is going to be shared. And with that, I give my space and the time to Mr. Patrick to go ahead and speak about the services that Parkland has available and preventative measures that we can take to avoid getting to go to the emergency room or having to go to the psychiatric area of the Parkland Hospital. But in case we do, he's also going to share with us how we can go about doing that. Mr. Patrick, the floor is yours.
All right, thank you so much. I'm going to share my screen. I'm hoping everyone can see the screen. Again, first of all, thank you so much, Iris, for you guys having me today. I'm excited about being able to be a part of anything that's really going, as I echo what Todd said, it's really about educating people, trying to make sure that they have the best life that they can in the midst of some issues that they may be struggling with. So I'm going to talk about behavioral health at Parkland. And one of the things that I want to share here, 4 things primarily, is I'm going to just start out by talking about the whole mental health climate of North Texas. Then I'll get into services that are provided by Parkland and how Parkland responds to mental health crisis. And then I'm going to share, as I just said, some community collaboration and partners that I think are beneficial for everybody to have, and just to have their numbers and contact information. First thing I want to share, I thought about Todd, and so I am a mental health first aid instructor as well, but I'm also certified by Florida State University in trauma, just to be able to identify that. And one of the things that we think about with trauma, most of the times we think about the hurricanes and the floods and the tornadoes, but we need to understand that right now there's a traumatic event. COVID-19 is impacting everybody in some kind of way. It may affect you differently this way, someone else another way, but it is a traumatic event to everybody. It's just having a major impact on the lives of all of us in the state of Texas and the United States. And so with that, because there are things that happen post-trauma or even during the traumatic event, mental health issues are just on the increase. And people, I say this, I'm not a doctor by no means, but mental health will be our next pandemic. We're going to have some major issues as a result of what's going on with COVID-19. And with COVID, but with some other things, there are limited availability of community inpatient psych beds. Of course, COVID, pushes patients out of the hospitals, but also we've had a lot of freestanding psychiatric facilities that have closed in the past 5 to 8 years. And there's recently one that's going to close the last day of this month that's actually located in Garland. So again, those are beds that are taken out of the system that now people have to try to find a way to go or place to go when there's crisis. And because of COVID, that puts a stress on the other facilities. I'm sure Todd and other PDs, they have a list of facilities that they can take people to. And, on their route or before they get there, they're trying to see, I don't want to drive there if you don't have a bed. And sometimes they have to figure out, well, I can't go here, I need to go here. And sometimes they may push a person further and further and further away from being right here in the Dallas-Fort Worth area. So, and the other piece of the climate is there with the insurance and how things are in Texas. Texas ranks near the bottom of how they provide mental health care for the residents of the state of Texas. And you have a lot of people that are indigent, meaning they don't have the resources. Then you have people that are uninsured. You have the people that are underinsured. And because of that, that also puts a strain on how they access care, what services they access, recidivism, which means it's just a recycle that they keep going in and out because of their financial means. They're not able to access quality mental health services. So the North Texas Behavioral Health Authority is kind of the primary person that does that. And we'll talk about them as we move further in the presentation. So when you talk about COVID, I just wanted to share, these are just some statistics that you have. This was back from June of 2020. So they're about over a year old, but these are the percentage of adults who reported trauma or having some kind of stressor related disorder symptoms during the COVID period. And as you can see, it's broken down by ages, but I'm sure now that these percentages have changes. They've over a year old, but we had 46% between 18 and 24, 36% between 25 and 44, 17.2, 45 to 46, and then 9% of the population over 65 that are having reported some type of trauma or having some kind of stressor that's directly related to the COVID-19. So it's very prevalent. It's something that's in our face, and it's something we should not ignore. Okay, so let's talk about how we access services at Parkland. Of course, there's through funding or private insurance. If you have private insurance, you can come to Parkland and get services. And I'll talk about the range of services from seeing a primary care doctor all the way up to going to the emergency room. But for those people, in the previous slide, I talked about the indigent population. We have the Parkland Financial Assistance Program. And I provided the number there on the screen, but they're open from 9 to 4. There's the physical address. But a convenient thing is that in every Parkland clinic in Dallas County, there is a financial counselor there that can help them with the enrollment process, to what they need, the documents they need to be able to qualify. Another way is to have a Parkland primary care doctor. One of the things that we're trying to do is we have this thing called integrated healthcare, where they come to Parkland, and because now they have a primary care, they have access to podiatry, they have access to the OB/GYN, they have access to all of the service, mental health, because it's an integrated service, because now they are part of Parkland. So if they have a Parkland PCP, it makes it extremely easy for them to access mental health services when the time comes. And Iris, if you need this information after we finish, or if people don't get it, just let me know and I'll make sure you have it. All right, so here are all of the services that are available at Parkland. And I'm going to start at the less intensive all the way until we get to the most intensive services at the bottom. But we'll start with our integrated care, and that's at our COPCs, which is just our community outpatient clinics. And I'm going to show you a map of where they are located. Then we have a psychiatric outpatient clinic. That's where I'm housed on Harry Hines Boulevard. We have a psychiatric emergency room that has the capacity to have 25 people in it. We have what we call an extended observation unit that has the capacity to have 18 people in it. And then we have a psychiatric inpatient unit that's in the Parkland building on the 17th floor. And there are between 25 to 28 beds that are available. And then I'm going to talk about the Right Care team that deals with the police and when you call 911. All right, so here's a comprehensive map of all of the OPCs in the Parkland system. And my colleague, Andrew, is going to talk after me, but there's especially clinics for home, palliative care, integrated pain, access, geriatrics. We have one in Grand Prairie. The newest one that's coming online next week will be at the Redbird Mall. It's called Redbird Health Center. There's one in DeHaro that is off of Westmoreland, Westlake, Oak West, Blewett Flowers. A lot of people have heard of that one. There's one at the Hatcher that's right across from the Dart Rail Station. Southeast, which is in the Pleasant Grove area, Vickery. There's one in Garland that's located on Hopkins Road. And then Parkland Health Center for the adults, which is at 6300 Harry Hines. That's where I am as well. So this is a map, try and just kind of give you an idea of where there are outpatient clinics throughout the city and in the county of Dallas. Okay, here are some outpatient services that you can kind of access at those clinics. Then when I talked about earlier, you can see over to the far left, the integrated behavioral health. It's for adults and pediatric patients with mild to moderate symptoms. And we'll go into that a little bit on the next slide. But these things that can be addressed at the clinic, the PCP can make a referral. There are mental health counselors in those clinics. And again, our goal is if we can try to get a handle on the issues prior to it becoming a crisis, is really what we would like to do. And I know that the police departments and Todd and his cohorts, they would love that if the 911 calls could decrease. Well, this is a way to do that. If we can address the issues, make sure a person has the proper diagnosis, and make sure the person is on the necessary medication, those things can reduce the amount of 911 calls resulting in a crisis. So we do consultations, treatment for short term, there's psychiatrists, medication management, individual and group therapy. The PCP kind of manages the thing. There are gatekeepers for the mental health services that are there at Parkland. Homes, I'm not going to get too much into that because that's where Andrew is, but we have those services available at homes. Our WISH clinic is really for our women's behavioral health needs addressed there. And then the special behavioral clinic, that's where I am. And again, these may be symptoms that are a little bit above mild to moderate, not severe, but there's things that they really couldn't be handled in the at the PCP site, at the integrated behavioral health. They can make their referral to the specialty clinic, which is at 6300 Harry Hines Boulevard. And there we have specialist services, addiction, geriatric services. We even have services that are there for the Parkland employees. We have a psychiatrist that will see Parkland employees if necessary. So this is just kind of a synopsis of the behavioral health outpatient services that we have. And again, this is a little bit more breakdown how we target, I guess, and that may not be a good word, but the patient population. What's appropriate for integrated, and those are the ones that are out in the community: mild to moderate chronic pain, sleep problems, family marital issues, psychosocial stressors, at-risk substance use, patients with high service utilization, and just patients that may have some different challenges. Now you go over to the specialty clinic: mild to severe depression, bipolar, schizophrenia, memory disorder, anxiety disorder. There's the trauma and the PTSD, psychogenic, non-epileptic seizures. We also have brain studies that are done there, but additional bridge services are always there. So this is just kind of gives you a synopsis of what we do and where we handle different types of patients. All right, so now from there, let's say that we get into the 911 crisis. Clinicians on 911 calls, they're qualified mental health professionals. Some people call them QMHPs. They originally were Parkland social workers, but now they're connected with NIPA, the North Texas Behavioral Health Authority. And what their role is to assist the citizens that are calling 911 to provide resources, trying to de-escalate the situation, you know, to see if there's some things we can do. They make triage calls to the right care team because it may not be necessary for the officers to go out. A lot of times, and I'm sure that Ms. Claudia can attest to this, but when your child or your loved one is experiencing this, in your mind, it's a crisis. But it may not be to the point where we need to actually dispatch law enforcement. And again, so educating the people, that's why I applaud you, Iris, on what you guys are trying to do, because there are certain times when it's just not necessary to reach out to the police department. But if you do that, Parkland started, I think it was 2018, with the Right Care for the community. And Right Care means Rapid Integrated Group Healthcare Team. That's why the name is Right Care. And so how it works is for Dallas residents, and how you get the right care when there's an emergency. You call 911, you actually speak to a clinician in the 911 call center, and they are offering you telephonic services and assessment. Or you can call and ask for the Right Care team, and they can dispatch a team that will come out with the officer. If there's a Dallas police officer, he or she can also request that the right team be a part and accompany them on the call. And you know, we all have been aware of some of the things that have happened on the news and in social media when there has been a mental health issue, mental health crisis, and law enforcement has come, and it may have turned out to be something that's not a positive outcome. So the Right Care team was kind of developed to help minimize that when there is a mental health crisis. so that social worker, that qualified mental health professional will be there with the officer to, again, to try to de-escalate the situation so there won't be any negative outcomes from the call. All right, in the event that they do have to come to the psych ED, this is kind of how the entrance where the police officers would drive up. We see the little cat there trying to get in, but once they get in, there's an extended observation unit. We have an initial psych intake, and then if necessary, they will actually go up on the unit. Now, again, that's going to depend on, and Dr. and Todd can attest to this, if there is a bed. So a lot of times a person may spend some time in the observation unit, and people may think that that's not appropriate, but we're trying to decide where to send them. Does this hospital have a bed? How far do we want to go? I mean, I don't know how far Todd has driven, but when you got people coming from Navarro County, from Ellis County, from Grayson County, they're driving all this way. Sometimes the beds fill up pretty quick. So we have community partners developed to improve the overflow, mobile crisis teams, and again, the Behavioral Health Authority, which I will talk to address here next. But they can come to the ER. But I just really want to stress the fact that we want to make sure that it is a crisis, because a lot of times they can get bottlenecked because everybody's flooding to the ER, and this is really not a crisis situation. So when you call, talk to the right care people just to make sure you have a good direction on where to take your family member or your loved one. So community collaboration, and here's some of our partners. I talked about the North Texas Behavioral Health Authority. We call it NIPA, but they do services for Dallas, Ellis, Hunt, Kaufman, Navarro, and Rockwall counties. So you can only imagine that's a huge area. But Garland County used to be a part of this, but they aren't now. But Ellis County does not have a psych facility. Hunt County does not have Hunt County does have one. Kaufman County doesn't have a psych facility. Navarro doesn't. So again, they're going to bring those patients into the Dallas-Fort Worth area. And again, this is why it's so critical to know when it's appropriate to do that. They provide services for individuals experiencing mental illness and or substance use disorders. And then there's a local 214 number, but also a toll-free number where you can call to access them. And also, if you go to this website I have provided and just hit /services, you can see all the services that they have there at the North Texas Behavioral Health Authority. And the other community partner that I really want to bring up is MetroCare. Now, MetroCare have services all throughout Dallas County, and they provide services for children, adolescents, as well as adults, also geriatrics, and they also have an autism clinic that's located in DeSoto. But adult services are for community treatment, chemical dependency. They have a homeless program as well, mental health care. They serve our veterans. They have pharmacy services. Primary health care can be done there. Again, it's an integrative model. The same thing for the children, mental health. If they are family members of a veteran, they can also access services, and they try to have youth empowerment services as well. One that I did not mention is the VA. The VA of North Texas does have mental health services for veterans, and so that is also a place where that particular population can go and to receive services. So that's my time, and I'm open to any questions that anybody might have at this time.
Thank you so much, Mr. Patrick. That is very, very useful information because, as you mentioned, sometimes those beds do get filled up very quickly. And when families receive that answer, they get scared, they freak out because they say, well, then what's going to happen now that those beds aren't available? So as Mr. Patrick mentioned, our purpose here is to try to assess and see if it really is an emergency or it's something that could be managed.
And let me stress, Iris, that I want to make sure that the audience knows and your families knows that the jail is not the place for them to get mental health treatment. It's not. it just continues the cycle over and over and over, and they're in and out. I mean, they're just not, and sometimes the experience of going to jail can be traumatic. And again, yeah, so, you know, I just really hope that we can start at that lower level. As soon as we identify something, and I'm sure Todd is shaking his head, that we can get that person, we can get that person into a provider before it escalates into something that's more catastrophic. So hopefully we can do that.
Thank you so much. There is a question from Ms. Laurie, and I would like to ask that right now instead of towards the end, if you don't mind. She's
Absolutely.
asking if there is an age limit for psychiatric services at Parkland.
Good question. Yes, Parkland, anybody can be assessed there, but as far as being at the hospital, we do not have beds for anyone younger than 18 years of age. Of course, that should be done at Children's Medical Center. But again, Children has a very limited amount of beds. But there are other facilities in the Metroplex for child and adolescents: Perimeter in Dallas, Hickory Trails in DeSoto, Dallas Behavioral in DeSoto. They have psychiatric beds. But again, Ms. Laurie, the key is if we can get that child to a therapist or get them involved in Dallas ISD psych services prior to it becoming a crisis, a lot of times we can prevent that trip to the ER.
Thank you so much, Mr. Patrick. I hope that answered your question, Ms. Laurie.
Thank you.
If not, we will have more time towards the end of the symposium for more questions. And now I will give the time to Mr. Todd.
Hey, thank you very much. I just want to reiterate how this is really important to us at the Garland Police Department, and important to me personally, and as the president of MetroCare Texas, to participate in these kind of community partnerships. Without these, we just can't do and can't accomplish the mission and our purpose that we're passionate about. So one of the things we were going to talk about today from the police perspective is if something occurs, there's a brain health crisis that occurs, and it seems like it's necessary to call 911 and have law enforcement respond. And we want to kind of try and look at what are some basic things we could consider to try and help increase the likelihood that it's going to be a positive and actually helpful experience for everyone involved. One of the things that's challenging in any profession or any trade is as soon as you start going outside of your skill in that trade, it gets much more challenging. And it's really easy to understand. Like if my home air conditioning is broken, I want to call the best specialist in home AC. I probably don't want to call an auto mechanic or a plumber or something of that nature. Even in the health services, if I need surgery on a disc in my low back, I'm probably not going to ask my home healthcare, my family doctor to do that surgery. I want to get the most specialized person. So that presents a challenge, for law enforcement when we're going to be coming out for something that's going to be outside of our main trade, our main skill set that we were trained for. So if this happens and there's a crisis of that nature that you feel that needs to be an immediate response and there isn't anything else in your area, there's no CIT team, there's no right care team, there's nothing like that, and it's just going to be law enforcement patrol officers dispatched out. One of the things MetroCare Texas addressed right away was one of the innovators around here is having, and I'm not going to use a PowerPoint to share my screen, I'm going to do a real old school style. We have a checklist. So we have a 911 checklist for any kind of brain health crisis. And we'll have this information available for you that can be emailed out by Irish. But the checklist is something that you could save on your phone. Maybe you use a note section of your phone. Maybe you could just keep it handy somewhere in your house if you still use a landline. And the checklist is something also you could just read a few times, and maybe you have more of a photographic memory than I do, and you'll just remember some of them. But a lot of it's basic things that we can forget about when we're experiencing a crisis with one of our family members or someone, you know, that we care about. So if you're going to call 911 and you have a family member, maybe they're have schizophrenia, maybe they have a co-occurring condition, maybe they're suicidal, and you're going to call the police because you need crisis stabilization, you need crisis intervention. Our checklist just has some real basic things that can be forgotten in the heat of that crisis. So obviously you want to give the person's name that's in crisis, because a law enforcement professional like myself, I want to be able to personalize the interaction, and I want to be able to use the person's name. I don't want to be saying, hey, you, or hey, guy, or I really don't even want to be saying sir or ma'am. I want to be able to personalize the interaction and use the person's name. Obviously, we're going to need a real good address of the location of where we're going. If there are any weapons, if the person might be suicidal and they have a knife right there, we need to know that information. So while we're going, the team can be talking to each other, communicating on the radio, formulating a plan that'll include slowing things down. We don't need to rush into the location. We want to slow things down if there's a weapon present. We want their age. We want to know, their description of their clothing. We want to know their diagnosis and maybe some of what they do. Are they prior military? Were they deployed during the last 20 years to a war region? We might want to know their diagnosis. Do they actually have they been diagnosed with maybe PTS or schizophrenia or clinical depression or something co-occurring? I say co-occurring, like maybe had they been, do they have an addiction to something, maybe medication, or maybe they've used some other drug because they're trying to figure out ways to reduce the pain they're in. So they're trying to figure out different things to do for that. Sometimes some of those things aren't the most helpful. That'll be important information for the responding officers to know. If there's ever been any previous suicide attempts, if there's ever been any kind of previous violence, that's really, really important for the officers to know, because that's going to tell a professional like me, as I'm en route, I want to focus on slowing this encounter down. I don't want to rush into the house if that's not necessary. I want to have time to communicate with the family members when I get there. So past violent behavior or suicidal behavior with a weapon would be really, really important for a professional, law enforcement professional like myself to know about. So I'll have that information to be like, whoa, let's pump the brakes. Let's slow this down when we arrive. We want to know other details of maybe the diagnosis. Has there been psychosis? Has there been any hallucinations or delusions? That'd be really, really important information for a professional like myself with this trade in law enforcement, and my main learned skill trade. I need to know those things, so then I'll better prep myself to slow things down and to be successful. If someone's hallucinating, if someone has delusions, and I get to know about that ahead of time, I'll be prepared for that, and I'll be able to react appropriately, where I won't challenge the person on the delusions. I won't say that's not a such thing or anything like that. I'll be able to work with that, and I'll allow them to, that's their reality. I'll be able to allow them to, hey, that's their reality. I don't have to argue with that. I don't have to challenge that. It'll be really important information. On our checklist, we have something, it's kind of a negotiator term. What's the person's triggers? So what's like something that's like upsetting to them when they're in a crisis like this? If we could have that information while we're en route and you're telling call take on 911 that's going to really help me, because as a professional, I'm going to stay away from that. I won't even mention those things. If I hear that, like, hearing or seeing lights on the car, or maybe even the police uniform is a trigger, is speaking authoritatively or something like that you wouldn't want to do with someone in crisis anyways, trigger, I need to know that. Anything that's upsetting, I wouldn't want to talk about something like ask the person, hey, what do you do for a living? If some of their current stresses are connected to losing their job because of COVID-19. So I don't want to try and use that as a connection. So anything like that that could be upsetting that because you're the family members, you're the one living there with them. If you know that it could be upsetting, if you can tell 911 call take that, that's going to help increase the likelihood that the officers show up, that these professionals show up, and they're way more prepped for success. Another thing that's really important, that's the opposite of a trigger, is to empower these law enforcement professionals to know what's helped in the past. Like what has helped with your loved one in the past to trying to kind of get back more to their normal. Is it just letting them vent? Is it just letting them speak and talk? And they don't need a lot of resources bombarded at them, and they don't need any solutions thrown at them. Maybe they just need to ventilate and be heard. Anything that has helped in the past, maybe helping in the past would be getting them out of the house, and maybe they're more comfortable staying out front. It's more of a neutral space, fresh air outside, just anything that you know, because you're the one living there with your loved one or your friend, that has helped in the past. All these things that we're talking about, that's on our 911 checklist here, they're all things that really, really help this professional that's coming out to assist your family. One of the things that's a note, then an addendum on our checklist, is it says to keep in mind that you're asking an unknown professional to come to your home to help resolve a crisis. This unknown professional will have no information, just really important to reiterate that, about the situation or your loved one, unless you inform 911 call take and the officers when they show up. Besides that, they're just showing up, and they are not a clinician, they are not a psychiatrist, they don't have that trade skill set that's so important. So without that information, they're showing up and just going to have to try and figure it out for themselves, and that's not a good plan. That's not the best plan. So our 911 checklist at NAMI North Texas is one of the things that can be really, really helpful. And then those points that I just talked about. One of the things, over 16 and a half years in patrol, and I have went to so many brain health crises, and I do affect so many emergency detentions, and still do to this day, to a behavioral health hospital. It's really, really important to know is the communication with the officers when they show up. So if it seems like the officers are rushing it, because a lot of officers work 12-hour shifts and there's a high call load. I mean, there can be 10, 20, 30, 40 calls in the queue waiting for a response. So it can lend officers to start feeling rushed, like they just want the basic facts and rush to get this call concluded and go to the next one and go to the next one. It's kind of systemic of the call load in the profession. So when officers would arrive to your family's brain health crisis, anything you can do to try and help slow down what's going on. Like if there's no need to rush into the building or rush into the house or rush up to the vehicle or wherever your loved one is, it's in a brain health crisis, anything you can do to remind and talk to the officers to try and give them more information, maybe even verbalize, hey, let's slow this down, because you called 911 and maybe it was 8 minutes until officers showed up. Maybe it's even a little longer if it's busier. Maybe the dynamics has changed some since you dialed 911. So you can help give that information and kind of helping be a calming force, and even like I said, verbalize. Hey, can we slow this down? Because to a law enforcement professional, that'll be music to my ears. I would love to hear that we don't have circumstances that mean we have to just rush into action. That's really can be important, is to remind officers that are arriving that maybe things have changed in 8 minutes or 10 minutes or whatever it might be, and we can kind of slow things down. I really, really will just echo Patrick and other brain health professionals that I work with, is we want to be partnering with you and families with loved ones with a brain health diagnosis or condition, either crisis or chronic. And we really want to try and avoid needing to have law enforcement come out and an emergency detention occur. Because I have talked to patient after patient, hundreds of patients, and having handcuffs put on you and put in a cage of a squad car to go to a hospital is just not a therapeutic experience. And it wouldn't be for any condition. I mean, if I broke my ankle, I don't want handcuffs in the back of a cage in a squad. Like, that's not where I'd want to go for any medical condition. So anything we can do working together and sharing these resources and having these conversations, our goal is to minimize the amount of times that law enforcement needs to come to effect an emergency detention. Will be really, really helpful to our shared purpose, our shared cause for the best medical treatment we can get for our loved ones that have a medical condition just happens to affect their brain. It's just something that's really, really important for us to all work on together, is getting those resources out there, getting to these conditions way ahead of where it ends up being a big crisis, kind of like a heart attack, you'd say. We could get to those symptoms way ahead of time and prevent a heart attack. It's what we're really, really focused on and looking for. One other thing I wanted to touch on real quick before I would love to have any questions is from my personal experience, I'm just speaking from my personal experience, 16 and a half years in patrol, going to crisis calls, affecting emergency detentions, and then now in the last 3 years working as a mental health liaison. An emergency detention or a mental health warrant is primarily crisis stabilization. It's not a long-term cure for the condition, if you will. So some of the families that I'll work with, and either their loved one or their friend was emergency detained, or they went through the whole process to procure a mental health warrant with either the county or their justice of the peace. Like in Garland here, you can go to the local justice of the peace, and the county constables then serve that mental health warrant. They were going into the process, either one, thinking that this was going to lead to possibly weeks or months or longer of inpatient treatment. And that is not how either one of those work in my personal experience. They're crisis stabilization, kind of like an emergency room. You show up, you've got a compound fracture of your thumb or a bendix break of your thumb. You go to an emergency room, they're going to crisis stabilize that injury, and then they're going to send you out for outpatient treatment to find the specialist to do more work on that to get you back to your normal with that injury. And so when I'm working with families, what's really important to me today to speak with your audience and anyone that'll see this recorded is to keep that in mind, like to keep in mind that this is crisis stabilization, either the emergency detention or the mental health warrant, and your loved one will receive crisis stabilization services and then an outpatient, follow-up outpatient plan to actually get back to their normal and have more good days than bad. I think that's something really, really important because I've had family members in my office on the phone with me visiting them at their house, and they are very emotional. They're very upset because after an emergency detention or a mental health warrant, their loved one only received 3 hours to 3 weeks or whatever it might be of treatment, and their expectations were something totally different. And I think sometimes law enforcement, we fall short on that because we don't quite have an understanding of that, and we kind of thought it was going to be something that might be months and months of inpatient treatment. So we might be part of the problem sometimes where we don't have understanding of that, and we don't set the appropriate expectations. But that's kind of a basics of that. There's a lot more to it. It's obviously a complex system, and healthcare is so expensive. It's unbelievable how expensive it is. Cost is such a huge barrier. When I'm working with these residents that I serve, that's something that's really important to me. I don't want to recommend something to someone that's $350 an hour and it's in Frisco or it's in Austin or it's in California, because I can't afford that. And if the people that I'm working with, the residents I'm working with, if that's not an option then for either, then that resource has no value, none at all. So it's really
Todd,
important. Yes.
Todd, let me help you, sir. You're absolutely right. A lot of parents, a lot of families don't understand, even with insurance, they're going to get you there 3 to 7 days and you out of there. He is absolutely right. The key is to follow up with those recommendations that have been given for outpatient services with that MetroCare and the North Texas Behavioral Health Authority because even with insurance, it's not going to be alone. It's not going to happen. It's just not going to happen. So thank you for saying that, Todd. Thank
you. In conclusion, real quick, there's several really good resources in North Texas. Obviously, NAMI North Texas is one of them. Always no cost. Always someone you're going to speak to. Since it's non-therapeutic, you're going to speak to someone with lived experience. You're going to literally get to speak to a peer that is going to be helping to guide you through what's worked for them and their family, what hasn't worked. It's something we're really proud of at NAMI North Texas. Another one of our really good partners, and I know Patrick knows all about, is the Grant Halliburton Foundation. You can't see it, but they've got, there it is. They've got a mental health navigation line at 972-525-8181. It's open Monday through Friday, 10 to 6. They have English, Spanish. They can accommodate some other languages. And the mental health and addiction navigation line at Grant Halliburton Foundation is really an awesome resource in North Texas. And just in a quick snapshot of what to expect, when I promote the mental health navigation line all the time to the families I work with in Garland, when you call that number, you're going to have a trained navigator that's passionate about what they do. And you're going to speak to them, but give them kind of a snapshot, kind of like we said on the 911 checklist for the responding officers. You're going to give this navigator a snapshot of like what's going on with your loved one's brain health condition, what's worked in the past, what's not, what kind of treatments are they in right now. And then the Grant Halliburton Foundation, they operate at such a high, impressive level that they're not going to just respond right then to you because they know they can't do a high enough level job by responding right away. So they're going to take your contact information, phone, email, whatever your preferred one is. And within 48 hours, they're going to respond to you with what their team of licensed clinical social workers and so forth, professionals in this area, what they think you should try out. A couple of resources that they think you should try out, or someone you should go talk to and see, some kind of referral. I mean, it's just really an awesome option to have. In place is something like that, a mental health navigation like that. We'll have that number for you to be emailed out by Iris, but it's a really good service, really good partner of ours. And there's many other ones. The North Texas Behavioral Health Authority has this crisis line here to call. It's really good service. We'll have that number included too. Don't be dissuaded if you hear something like, oh, it's based out of Houston. Well, yeah, that's where the call center is. But when you call and say where your geographic location is and what you're looking for, they're going to refer you to something like, say, TransitCare and their mobile crisis team, which is local here in North Texas. They're going to refer you to something that's appropriate to your region. So some people get really concerned when they hear that this call center is in Houston. And that's just where the call center is. That is the clearinghouse for these numbers. But they're connected with services that are appropriate to your area. So don't let that dissuade you from using that. But that's just a couple resources. There's so much more, but I really appreciate this time. I know we're going to collaborate and work more together and have more of these kind of conversations and blast out more of this important information. But Irish, Claudia is going to fall asleep because she knows I can start talking and before I know what an hour has gone by. So I think I'll go ahead and stop right there. If there's any questions, I'd love to address those real quick, but I'm really looking forward to hearing the other panelists speak.
Thank you so much, Mr. Todd. Truly appreciate that. I have added the survey link on the chat so that anybody may go ahead and fill that out and add your email to it, and we will be able to send the information that Mr. Todd was talking about and any other information that they may want to share with you all. I did want to give a couple of minutes to Mr. Andrew to talk about the services that Parkland has for people in the homeless community. And then after Mr. Andrew, you all are free to ask questions. You may add them to the chat, and I will go ahead and ask those for you all to the panel and give them a couple minutes to answer any other questions that you all may have. Mr. Andrew, the floor is yours.
Thank you. So The homes program operates for the homeless community here in Dallas County, and we provide medical services in our mobile units, and we have 2 freestanding clinics. One of those is at the Bridge. The other one is at the Stew Pot at the corner of Young Street and Park, real close to City Hall in Dallas. So right there, patients are able to access that clinic who maybe had been previously in a shelter or are on the streets. They can access the Stew Pot clinic. The Bridge Clinic is really kind of for folks that are residing at the Bridge and can access the clinic there. So we provide behavioral health services at Parkland right now at the clinics and all of our COPC clinics too. We do a brief suicidal, homicidal. We evaluate for depression and see if there's anybody at risk because of the high suicide. You know, people die by suicide at a high rate. So if in the context of somebody is willing to, is interested in behavioral health services, we will set up individual appointments with them, psychotherapy, and we'll try to do that. Either I have an office here at the main hospital, or I see folks at the Stew Pot. We also offer at the Stew Pot a transgender clinic, and we provide services there as well as behavioral health services for those folks, those patients. Trying to think what else would be helpful. A lot of our services are through the shelters. So kind of piggybacking on what Patrick shared earlier, how you would access services, behavioral health services through Parkland would primarily be through our COPC clinics in the community. Our services are primarily for, like I said, for the shelters. And we also sometimes jump into when there's some type of disasters and go down to the convention center to offer services there when needed.
Perfect. Thank you so much, Mr. Andrew, for sharing that with us. Now I will go ahead and open up the floor for any questions that you all may have. Ms. Lori, Ms. Jane, Ms. Tasha, if you all have any questions, please feel free to ask those. I know Ms. Jackson had to head out earlier, but please feel free to ask anything. And I saw that Mr. Todd went ahead and added his email. So please feel free to keep that with you. And I will also send those out in an email. I will send everybody's email out if they're okay with that. Any other information that you all would like to share, Mr. Todd, Mr. Andrew, Mr. Patrick, Ms. Claudia, if you would like to share from your perspective as a family member, as a loved one, any advice on how to proceed when there is a crisis in the home, that would be wonderful as well to get that perspective. You're muted.
All right.
There you go.
I think one of the most important things, except for the first episode, is the prevention. Prevention.
Yeah.
And with the prevention, people will ask each other, what can we prevent? How can we do it? Well, that's why we have all these organizations that they can tell you, they can show you, they can guide you what to do. NAMI is a great example of where you need to go, because you have a family member who's been through this ordeal for many years, tell another family member, and it's a peer support group. Then it's peers talking to another peer and tell them what they help them, what was then make them stable, so they can try it as well. so it's a way then understand what's going on with the mental illness. Now we all know very well that unfortunately mental illness is chronic. We can stabilize her, but we cannot cure it right now. So the fastest that we can learn this concept, like Todd says, the police department is not here to solve our problems. It's not to give them a permanent solution. It's just to make it stable, just to decrease a crisis. So the earliest that we can understand as a family member to learn what to do. If I have cancer, I know what kind of doctor I'm going to see, what kind of people I'm going to be associated with, what kind of books I'm going to read. Whenever you have mental illness, you need to go with specialists that know what to do. So prevention. And I don't know if Todd want to speak to about the, we have a line of, then we're going to put in our telephones, start, I believe, is July of next year. It's called 988. Then actually we already approved. Then we already passed the bill. Then we already have the money. But right now, the government is in transition of train people. It's not just to put a number. It's just to train them, to tell them what to do, et cetera, et cetera. Wherever people in a mental crisis, they're going to call 988 and they're going to have a special person that can tell them what they need to do instead of call 911. Do you want to get more about that, Todd?
Just like really the other thing I would just add to that is like, imagine how impactful, like 911 is so impactful when you have an emergency. It's so easy to remember. Imagine how impactful it's going to be to just remember those three numbers rather than what's that 1-800 number or which crisis hotline should I call? The North Texas one, or should I call the national one? Imagine how impactful that's going to be to just like 911, remember 3 digits and call it and reach someone that's trained, passionate about what they're doing to assist you. That's one of the things that I just wanted to add. It's going to be so impactful to have just a 3-digit number like that.
Okay, perfect.
There was one other point of Claudia's I think is really good to just reiterate is, so a brain health condition is chronic. That's true. There's many chronic conditions that can afflict the human experience, but you can live a really good life with them. So, you could have a chronic back problem. You might have a chronic knee problem. You could have chronic high blood pressure. There's many, many things, but with the right treatments and the patient's efforts, you have way more good days than bad. I mean, you're living a good life. You don't even really think about whatever that chronic condition is because it's being maintained and you're living a really good life. So I just wanted to reiterate that, I have a chronic brain health condition. Well, that's not like meaning your good life is over. It's meaning with the right resources, connected to the right people, patient putting forth some effort, you're going to live a totally great life. Like you're not doomed like, oh, I've got this brain health condition and now my good life is all behind me. That's just not the case.
No.
Right. There's hope for recovery, one day at a time.
Absolutely.
Day at a time. Yes, and so with that number, the 3-digit number that you all were talking about, so information would be given out to individuals that call that number as to where they can go and what they can do. Did I understand that correctly?
Yes, exactly. And this is going to be a national-wide number.
Oh, okay. All right.
And it's dedicated to mental health problems. Yes.
Okay. Oh, that's wonderful, because as Mr. Patrick mentioned earlier, I think that, yes, the next pandemic is going to be a mental health pandemic. We've known for a while that stressors were piling up, that traumatic experiences were piling up, but I think this pandemic just truly shed a spotlight into how much we have all been keeping inside and bottling up, and now it's just something that's seconds from exploding, right? So we have to prepare and get our tools ready to help ourselves and get a good perspective of what is to come and what we can do to prevent and to help not just ourselves and our loved ones, but our community as well. And that's one of the things that I love from these programs and organizations that are working with each other, because we are the ones that are connected to the community, and we are the ones that the communities trust to come and ask help to and ask for information. So the more that we can pass that out into our communities, the better it is going to be, because then they can function as that. They can function as a community aid themselves. So thank you all so much for being here with us. Again, if there's any questions, Ms. Laurie, Ms. Jane, Ms. Tasha, please feel free to go ahead and ask those. And if not, I will give back 10 minutes of your time to Ms. Claudia and Mr. Todd and Mr. Andrew and Mr. Patrick. Thank you all so much for being here with us. If there's any other information that you all would like to share, please feel free to send it over to me and I will email it out to everybody. Thank you all so much and have a wonderful day. And if you will join us in our Spanish Symposium, we will see you at 1. Thank you.